this pandemic, this COVID-19 pandemic, this coronavirus pandemic that is raging across the world, it is an unprecedented event. Never before in world history, since the dawn of human civilization, have such a large number of people been impacted at once by one event. And that makes it unprecedented, quite literally. The closest parallel we have to this is what happened about 100 years ago. From 1918 to 1922, we had the Spanish flu. That was a pandemic. It is estimated that 1/3 of the global population at the time was infected. And anywhere between 50 million to 100 million people died. That's a lot of people. And this was before global air travel. And that flu still managed to infect 1/3 of the population when we didn't have as many big cities that we do today. We didn't have today's world population. We didn't have today's population densities all over the world. This is a new virus. There's no vaccine. Expert opinion is that this will go on for 2 years. Expert opinion is that although it might have started in winter, it will go through summer. It will not die down. It will not quieten down during summer. The best remedy right now is the social distancing and the lockdowns and people staying away from each other and people wearing masks and washing their hands and inhaling steam and drinking hot water. But even if we do all that, which we are not doing, even if we do all that, the idea is not that fewer people will be infected. The idea is to flatten the curve, meaning if everybody who will get infected, they get infected within the first 2 months, then we are helpless. Our medical systems in the richest of countries are helpless. And that's not even taking into account with countries, the majority of countries where healthcare systems are pretty much non-existent. So the idea behind flattening the curve is that the total number of people who might get infected, that might not change, or at least by not a whole lot. But if we spread that over something like 12 months or 18 months, then maybe we can provide medical attention to those who might need it. There will be those who get infected and they might not even show any symptoms. There will be those who might get infected, they might become symptomatic, but they might not end up in the hospital, they might not die. That will still leave us with maybe 10%, at least 5% of the infected who will need medical attention of some kind. That's a lot of people. That's a lot of people. And the number of dead, if you just go by the math that this 1% of those infected might die, Do the math, that's a lot of people. And among seniors, people who might be older than 65, people who might have pre-existing conditions like heart disease, diabetes, other pre-existing conditions. People in that age group will be 10 times more likely to die if they get infected. In a country like India, where before this pandemic, somewhere between 20,000 to 30,000 people were dying every day from all sorts of causes, like old age, natural death due to old age, road accidents, infectious disease. Just from tuberculosis, India was losing something like 400,000. That's almost 500,000 people every year, just from one infectious disease, tuberculosis. So in a country like India, where somewhere like 30,000 people were dying every day before this pandemic, if 1,000 or 2,000 more people were to die because of this pandemic, would there be a mechanism to locate that, to find that out, that these 2,000 deaths were from this coronavirus pandemic? Maybe not. There's much controversy about how this all started. There are all sorts of conspiracy theories going on. The two big ones are, one, that this virus was cultivated as a biological weapon in some Chinese army lab, and it escaped, or it was let loose very deliberately. That's one conspiracy theory. Another is, no, it was the US Army. This was the biological weapon of the US Army, and that escaped from some lab or was deliberately let loose upon the minority population in this very country. Right? Do I buy into those? No. But these are conspiracy theories, like there are all sorts of conspiracy theories about who killed JFK or what happened on 9/11. There are a lot of people who don't think Osama bin Laden did that. There are people who think George Bush did that, right? Well, that's a conspiracy theory. Do I buy into that? No, I never bought into that. But the virus is here and the epidemic is raging on, and I think the brightest minds in the field they have already started work to find a vaccine, but that is at least 18 months away, according to expert opinion. And that is fast. Vaccines don't show up that fast. If it shows up within 18 months, that's record speed. But until then, until we have a vaccine, we have to think of other things that we can do. And right now, the only good option is social distancing, people staying away from each other. So when everybody is home, does that mean the economy collapses? Right? That's another big question. You don't want to end up in a situation where either people are going to die from this disease or they're going to die from mass hunger. And so just like this pandemic is unprecedented, it has to be tackled in unprecedented ways. Things that worked during the 2008 financial crisis will work as much as this COVID-19 infection can be cured with a flu shot. No, those measures would be vastly inadequate. There are political and economic implications. I think the number one thing that needs to be done is to create a world government that has jurisdiction globally, Only a body with that kind of authority will be able to take global action, closely coordinated global action. That's what needs to happen at the top. What needs to happen at the bottom is every government, every national government needs to coordinate with each other and simultaneously bring about these lockdowns. If there's that kind of coordination, that will be the least economically disruptive. And while you keep people in their homes, you've got to feed them. You got to feed everybody in their homes. That's the only way to keep them in their homes. And while you are doing that, this might be 3 weeks, 4 weeks, 6 weeks, the number one economic step that needs to be done, the number one stimulus step that needs to be taken is the universal basic income. And this cannot be in this country or that country, it has to be global. This has to go to every single human being, and that's the only way to resurrect the global economy. Or we're going to end up with something much bigger than what we had in the Great Depression. And then there are all sorts of intermediate steps in between. So with a world government at the top and a universal basic income at the bottom, we will at least have a starting point.